Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to bring you our update on the coronavirus pandemic in the United States, in Maryland, and here at GBMC. So as you know, the big news since we last spoke was the new variant called Omicron. Again, variants will continue to emerge until the world's population reaches a protection level that stops the spread of the virus. And we will get to that protection level when most of the world's citizens are immunized. We know that in the entire continent of Africa, only a very small percentage of people are vaccinated. So it should come as no surprise that we had the emergence of a variant in South Africa. To this moment in the United States of America, almost all of the infections continue to be the Delta variant and previous variants and not the Omicron variant. The situation over the last few weeks is that we have had a new resurgence of COVID-19. This morning, we had 919 Maryland citizens in the hospital, either in regular beds or in the intensive care units, and that has grown significantly over the last couple of weeks. Again, it shouldn't be a surprise when we still have so many of our citizens that are not protected by the vaccine. It has been a little disconcerting to hear that not all parents are getting their children vaccinated. You'll recall the CDC and the FDA have approved vaccines for children 5 and above, and we need all of those children to get immunized. And you know, I'm a pediatrician. I spent a large part of my career immunizing children. We know that children as a group on average, do not get very sick from the virus. The problem is they can spread the virus readily. We just had gatherings for Thanksgiving. We don't know the exact numbers, but I suspect that many children pass the virus on to their grandparents, to their parents, and to others. So please, if you have a child of vaccination age, please get him or her vaccinated. So here at GBMC, we have 16 COVID-19 positive patients. 5 of them are in the intensive care unit, and 3 of them are receiving mechanical ventilation. What about boosters? Again, we've discussed this in the past, but the notion of a booster is to give the body an antigen that will cause the response that has already been started, already lives within the human, to re-engage and produce more antibody, to make it less likely when that individual actually confronts the virus, that the virus makes them sick. We know that the vaccines are very effective at stopping serious illness and death. We've seen this since we started immunizing people. But again, if we want to stop the spread of variants, the creation of new variants, and we want to ultimately end the pandemic, the best way to do that is to get everybody vaccinated and to get people boosted when it is the appropriate time. So please get your children vaccinated and get your booster. But the virus is still out there. Please continue to wash your hands. Please continue to keep social distance when it makes sense. And it makes sense when you're indoors, and especially if you're with people who have not been vaccinated or you don't know their vaccination status. And also wear your mask. We're now in flu season. We're now in other cold viruses season. Wearing a mask will protect you to some degree from getting any respiratory tract virus, and it will protect from you spreading any respiratory tract virus to others. So you may want to wear your mask, especially when you're out and about. So I want to thank you for everything that you're doing to help us stay safe in the community. I want to thank all healthcare workers. Like most industries, we are working hard to make sure that we don't have unfilled positions, so we continue to serve everyone. But our people are getting tired, as everyone is, of the pandemic. So please do your part to keep yourself healthy. I want to wish everyone a very happy and peaceful holiday season and a very prosperous 2022. And I am very hopeful that we will say goodbye to COVID-19 once and for all in 2022. So thank you very much, and we'll speak with you again soon.